Up now, I'll be talking about motor system examination in neurological disease and how to do a motor system examination. Earlier on, we spoke about the sensory examination, where I told you guys that sensory examination is basically like you trying to check out if the patient has any difficulty in sensation. Okay, so like you're trying to see if their body is not numb, they are still responding. Okay, and sensory examination can also have to do with you are trying to test the patient. Do they understand what you say? Can they answer your questions? All right, so you ask them basic questions like maybe you choose a close relative and ask them, who is this? Okay, and you ask them, where do you think you are? That's when they are in a hospital. You ask them, where do you think you are? Just to try to see if the person is still having that orientation of in person and time. Okay. Then up to the next one, I'll be talking about motor system examination in neurological diseases. And motor system examination basically has to do with the muscles, basically has to do with movements. Okay. So you see, this is somebody trying to check out the knee, or maybe trying to check out the muscles of the thigh. Okay, basically trying to check out the lower limb. Okay, to see if the patient's lower limb is still functional. Our focus today is to discuss the motor system examination in neurological disease. How can you be able to examine if there's anything gone wrong with the motor system? All right. So moving forward now, this is still it. Maybe this one is grading of muscle power. Yeah. Okay, the patient will keep their hand like this and try to like apply a little force to push it down and see how much they can resist it. Okay, so I have a video coming on grading of muscle power. You don't need to worry much about that. Then for motor examination, these are the things you are watching out for. We'll list them and I'll tell you guys one or two about them. Stance and gaits. That's basically like you trying to see if the patient can still stand without trying to fall. Gait, that's like you trying to see if the patient can still walk. Okay, so this gets me thinking. We actually went for ward rounds that day in the hospital. So, and one woman was like, she has stayed so long in the hospital, she wants to go home. All right, so our consultant told her to stand up and walk to the door. Before she got to the door, we were walking beside her. If not, she would have fell with her head on the floor. Okay, so she had abnormality in gait. Okay, so he now explained to her that you could see you are walking but trying to fall. So don't be angry. Just give yourself some time in the hospital so that you recover, right? So that's basically seeking for consent of the patient, trying to explain things to them rather than acting like a boss. Then about the posture, okay, the person just stand up and see if they can stand straight, or maybe they are trying to like there's weakness in the muscle, okay, so they are trying to like find for support, okay, that's posture. Muscle bulk, that's you trying to check out if there's muscle wasting. And in checking out for muscle wasting, let me tell you guys, they could ask this in exams. In checking out for muscle bulk or muscle wasting, if it is the two hands that you are trying to check out, okay, lift the person's two hands and compare using only the person's right and left hand. Okay, so if there's muscle wasting in the left, you can see it because the right hand will be so much healthier than the left. Okay, so in muscle wasting, you don't just conclude that somebody's looking slim, so the person has muscle wasting. No, all right, some people are naturally slim. All right, so for muscle bulk, that's muscle wasting, you have to actually compare the person's body parts to their self. Okay, the fasciculations, that's basically muscle twitching. Okay, checking out for muscle twitching. Then abnormal movement, this is still gait, right? All right, if they are moving, do they have tremors, do they have myoclonic jerks? Then tone, that's a muscle tone. You are trying to see how uh, is the muscle still having its characteristics, or is it looking flaccid? Is it looking weak? Okay, that's a tone. Then muscle power, there's a muscle power grading. I have a lecture on that coming up. Muscle power is you trying to see if the patient can actually do horizontal movement, if they can lift their foot against gravity or any part of their body against gravity. Then you're trying to check if uh, if they are trying to move their foot or their hand, and if you still apply a little pressure, can they be able to overcome that pressure, right? So that's muscle power. Then reflexes, that's all those plantar reflex, extensor reflex, okay? That one is being elicited by the patellar hammer. Plantar response too is being elicited by the tip of the patellar hammer, right? So guys, this is basically an introduction motor system examination in neurological disease, all right? So all these concepts I have videos coming on them, and those videos will be in the playlist. If you want to look at the playlist, just go to the description of this video and you see the playlist there. Okay, and that's it guys for motor system examination in neurological disease. And bye for now.